Welcome to the deep dive. Today we're jumping into something really fundamental for any healthcare provider trying to keep things running smoothly: mastering medical claim denials.
It sounds maybe a bit dry, but honestly, this is all about the financial health needed to actually deliver patient care. Our goal here is to pull out the most important nuggets from our sources about how practices can handle claims that get denied.
That's exactly right. We're looking at, how do healthcare systems make sure they get paid for the services they give, especially when an insurer first says, nope. It's really about keeping the lights on and being able to invest back into care. So we'll unpack the system behind managing this. It's more strategy than chaos, or at least it should be.
Okay, so let's start with something basic, but super important. What's the difference between a claim denial and a claim rejection? Our sources are pretty clear on this.
Yeah, this is step one. A rejection happens right away, before the claim is really processed. Think basic errors, maybe a typo in the patient ID, wrong format, the system just kicks it back. Like sending an email with the wrong address, it just bounces immediately.
Exactly. But a denial, that happens after the payer has processed the claim, they've looked at it, and they're saying, we're not paying this, or maybe just part of it.
And knowing that difference is critical.
Yeah.
Why?
Oh, absolutely, because it tells you what to do next. A rejection, usually a quick fix, resubmit ASAP. A denial needs, a deeper look. You got to figure out the why. Might need more documentation, maybe even an appeal. It channels your effort correctly.
Makes sense. Okay, so let's get into those whys. What are the common reasons claims get denied? Our sources flagged quite a few usual suspects.
Oh, yeah, there are definite patterns. You see things like eligibility denials. This is a big one. Patient wasn't actually covered on that date. You really have to check eligibility every single time, not just the first visit.
Every time. Wow. Okay.
Yep. Then there's authorization denials, missing that prior auth for a procedure, often a slip-up in the front office workflow. Medical necessity denials. This one can be tricky. The payer decides the service wasn't medically needed.
That sounds subjective.
It can be. Good documentation is key there for appeals. Then coding denials, wrong CPT or ICD codes, may be unbundling things that should be billed together. Also, timely filing denials. Simple, but painful. You just missed the payer's deadline to submit the claim.
Ouch. Purely administrative.
Exactly. And duplicate denials looks like the same service was already billed. Could be an error, maybe a system glitch. Finally, coordination of benefits, or COB. Patient has multiple insurance plans and the payer needs info on who pays first.
Okay, that's quite a list. Some seem like clear errors, others, like medical necessity, need more interpretation. So, with all these potential issues, how do practices manage this systematically? What's the process?
Right, it's definitely a process. First, you got to capture and identify the denials. That means using the ERA, the electronic remittance advice from the payer, or the EOB, the patient's copy, spot the denials, figure out what kind they are.
Okay, so you spot them, then what?
Then you analyze the root cause. Payers use specific codes, SIARCs and IRURCs, to explain why they denied it. Digging into these helps you see if there's a recurring problem somewhere.
Finding those trends, right.
Exactly. Once you know why, you correct and resubmit. Fix the documentation, coding, whatever it is, and send it back in, making sure you're within the payer's time limit. If that doesn't work, you might need to appeal. This means writing a formal appeal letter, gathering all your supporting documents, and following the payer's specific rules for appeals. It's detailed work.
And you need to keep track of all this, I assume.
Oh, absolutely. Track and monitor. Keep a denial log. Measure things like how successful your appeals are, how long it takes to resolve denials, and the big goal really is prevent future denials. That means training staff, improving those front-end checks like eligibility and auths, maybe using claim scrubber software to catch errors before you even submit.
Ah, the tools. Let's talk about that. Our sources mentioned billing software, things like Creo, Advanced MD, and those claim scrubbers you mentioned.
Yeah.
Analytics dashboards, too.
Yeah, the tech helps a lot. And you need metrics, KPIs, to know if you're actually improving. Key ones are the denial rate. What percentage of your claims are getting denied? Lower is better, obviously. First pass resolution rate. How many claims get paid correctly at the first time? High is good means clean claims.
Less free work.
Right. Then days to denial resolution. How long does it take on average to fix a denial? Faster means better cash flow. And finally, the appeal success rate. When you do appeal, how often do you win? Shows if your appeal process is effective.
So pulling this all together, what are the real tangible benefits for a practice that gets good at managing denials, beyond just, collecting the money owed?
Well, the money's huge, obviously.
Yeah.
Better cash flow, higher collections, fewer write-offs. That's the core. But it also means better compliance, less audit risk. Honestly, it frees up so much administrative burden and, frankly, stress. It lets the practice focus more resources and energy on what matters most, taking care of patients. It builds financial resilience.
That really puts it in perspective. It's not just admin, it's foundational. Thanks for joining us for this deep dive on mastering medical claim denials. It's clear that understanding this process is, well, vital for healthcare providers.
Absolutely. And maybe leave you with this thought. Think about how these processes, which seem kind of back-end administrative, how they directly impact a provider's ability to actually deliver care consistently. It makes you realize why being proactive and systematic about denials isn't just good practice anymore. It's pretty much essential for survival today. What part of this whole system strikes you as the most critical piece for providers to nail down?